ওকে, স্টার্ট করছি। ওকে, রেডি। So clinical anatomy of liver. Okay, screen, is it visible?
Yes, visible.
Okay, very good. So first of all, the clinical anatomy. So actually, the anatomy of liver and the clinical anatomy of liver, this is little bit different. Okay, so these things are little bit different. Okay, so let's imagine this is the picture from Atlas. Okay, this is the liver, human liver. Okay, this is the human liver. The major demarcating ligaments, this is the ligaments, this is called your falciform ligaments. Okay, this is the anatomical separations, and this ligament separates the liver anatomically into a right lobe and a left lobe. Okay, so this is the anatomical ligament which separates your liver into right lobe and left lobe. Is it clear? So this is the falciform. This is the falciform ligament. Falciform ligament. Okay. This is the falciform ligament. I am going to write everything later. And this is the anatomical right lobe, and this is the anatomical left lobe. This is anatomical divisions. Okay, and later this is the gallbladder. Okay, in posterior side, in posterior aspects, and this is the anterior aspects of liver. This is the anterior aspects of liver. Okay, this is the anterior aspects. Anteriorly, you can view, you can it is visible, you can watch this, that anteriorly you can appreciate this, that this is the falciform ligament, this is the right lobe of the liver, and this is the left lobe of the liver. Okay, is it clear? Next,
Yes.
posterior view. So this is the posterior view. This is the posterior view from, again, this is also from Atlas. So in this posterior view, this is the liver. Okay, and the posterior view, what is this? This is what? This is what? This is what? This is the IVC. This is the group for inferior vena cava. This is the group for. This is actually IVC, and IVC is lodged within a group. This is a group on the posterior aspects, on the posterior surface of the liver. This is called IVC groove. This is called IVC groove. Okay, and another important structures is what? This one. This is what? This is the gallbladder. This is the gallbladder. Gallbladder, where the bile juice actually stored and concentrated. Okay, bile juice, this is secreted from where? Na liver, but it is stored and concentrated at gallbladder, and this gallbladder is also lodged within a fossa. If you remove this gallbladder, you can appreciate a fossa on the posterior aspect of the liver, and this fossa is called the gallbladder fossa. This fossa is called the gallbladder fossa, on which the gallbladder is lodged. Okay, clear? Is it clear?
Hmm.
Okay, is it clear? Okay, next, there are another two ligaments, and what is this? This is called porta hepatis. What is this? This is called porta hepatis. Now I'm going to tell you one important landmark, one important surgical landmark. This is what? It is a imaginary line. It is a imaginary line. This is a imaginary line. This is a imaginary line which is joining this imaginary line, which is joining this imaginary line is joining your IVC with gallbladder. Your IVC with gallbladder. This imaginary line is called Cantillis line. This is called Cantillis line. Okay, this is the Cantillis line, and this Cantillis line is actually imaginary divides your liver into two segments. Another one is the right, and this is the left. But at this time, at this moment, this is the right surgical lobe of the liver. This is the right surgical lobe of the liver, and this is the left surgical lobe of the liver. Not, I am not talking about now anatomical lobe. This was your anatomical lobe. Okay, this was your anatomical lobe. This is the falciform ligament. Okay, this is the falciform ligament. This is the right anatomical lobe, and this is the left anatomical lobe. Okay, and obviously, from posteriorly, somewhere, this is the location of your falciform ligament, which is not visible from posterior aspects, and this is the left anatomical lobe, and this is the right anatomical lobe. But I am talking about a imaginary line. I am talking about a imaginary line. This line is drawn from the IVC to gallbladder. Okay, and this imaginary line is called your Cantillis line, which is is which it is actually divides your liver into two aspects. One is your surgical right liver, another one is your surgical left liver, and it has a very important functions or very important. It is very important in surgery, okay, not in anatomy. So next, what is this? This is the porta hepatis. This is what? This is the porta hepatis. This is porta hepatis, and there are two remnant structures is also there. Two remnant structures are also there. These two remnant structures are what I'm going to talk about these things. Okay, what is this? So first of all, so if I draw a schematic diagram of the anterior aspect of the liver, so this is your liver. Okay, this is your liver, and this is the anterior aspects of liver. I am going to draw the anterior aspects. And what is this? This is very simple, the falciform ligament. Okay, falciform ligament, and this falciform ligament is dividing the liver into one right segment and another left, right lobe and left lobe, right lobe and left lobe. This is totally anatomical anatomical right lobe, and this is anatomical left lobe. Okay, this is anatomical right lobe and this is anatomical left lobe. This is the anterior aspect, सामने से. Okay, सामने दिख থেকে দেখছিস
Hmm.
anterior aspects, and this is the posterior aspects. Okay, পিছে से পেছনের দিক থেকে দেখছি. This is the posterior aspects. So already I described the posterior aspects. There is a fossa for the gallbladder. This is called fossa for gallbladder in the posterior aspects of the liver, which is appreciated at this. Okay, are you appreciating? This is the gallbladder fossa, where the
Hmm.
gallbladder is lodged. Okay, so yeah, this is the fossa for the gallbladder. Okay, and what is this? This is the group for IVC. IVC group. This is the group for IVC. Okay, inferior vena cava group. And I told this already. I told that a imaginary line which is joining the IVC to gallbladder is called Cantil's line, and this
Hmm.
Cantil's line has severe surgical importance, very important in surgery. Okay, now what is this? This is porta hepatis schematically. And what is this? Yeah, this is the, what is this? This is the fissure for ligamentum teres. And this ligamentum teres, it is actually what? This ligamentum teres is actually a remnant structures. Okay, and what is this tissue? This is the fissure for ligamentum venosum. So there is a fissure, and this is, what is this? This is the remnant ligamentum venosum. And what is this? This is the ligamentum teres. This is ligamentum teres and ligamentum venosum. Once again, what is this? Posteriorly, in posterior aspects, this is ligamentum venosum. Yeah, this is ligamentum teres, and this is porta hepatis. Okay, this is group for IVC, and in this picture IVC is clearly visible. And what is this? This is the gallbladder. Okay,
Hmm. Hmm.
these important things are visible anatomically, posterior aspects to liver. And one important lobe in Conrad classifications, I am going to tell you later. This is what? This is the this is one important lobe, and this is one important lobe, that is caudate and quadrate lobe. You can appreciate this. What is this? This is the caudate lobe. Okay, bhai, this is the caudate lobe. And what is this? This is the quadrate lobe. This is the quadrate lobe. So you can appreciate this thing here also. This is the caudate, this is the caudate, and this is the quadrate. This is the caudate and this is the quadrate. And in Conrad classifications, the caudate lobe, its number is 1, and the quadrate, that's its number is 4b. Its number is 4b. I'm going to discuss this thing later. Okay, so this is the posterior aspects. This is the posterior aspects. So at the posterior aspects, you can appreciate the group for IVC. You can appreciate the gallbladder fossa. You can appreciate the fissure of ligamentum teres, and you can also appreciate the fissure for ligamentum venosum. And the two lobes which is appreciated posteriorly to liver, one is your caudate lobe and another is your quadrate lobe. Quadrate lobe and quadrate lobe. Quadrate lobe, its number is 1, and quadrate lobe, its number is 4b. Okay, so Is it clear
Clear.
up to this?
Clear.
Is it clear up to this?
Clear.
Just a minute. Just a minute. So the anterior and posterior aspects of the liver, anatomically, is it clear?
Clear.
Okay, okay. Wait. Now, just a minute. I am going. I am going to talk about little bit the fetal circulations and remnant of the fetal circulations because these much things that the ligamentum venosum and ligamentum teres, it will be more clear if I talk about this. Okay. So just a minute. Just a moment. Yes. So just a quick view for the fetal circulations. Okay. Just a quick view, quick schematic view. Okay. So fetal circulations. Okay. So let's imagine this is the placenta. Let's imagine what is this? This is the placenta. This is the placenta. Okay. Placenta. PL means placenta. This is the placenta. Okay. And this is the umbilicus. Okay. U for umbilicus of the fetus. This is the umbilicus of the fetus. And somewhere here is the liver. Somewhere here is the liver. Liver of the fetus. This is the fetal liver. Liver of the fetus. Okay. Liver of the fetus. Now this is the inferior vena cava. IVC. Inferior vena cava. And this is the fetal heart. This is the fetal heart. I am drawing a schematic diagram of fetal heart. Okay. So this is your right atrium, left, sorry, right ventricle, left atrium, left ventricle. Done. Easy everything. Okay. And what is this? Now I'm going to draw the umbilical cord, and within this umbilical cord, this is the umbilical cord. Actually, this is the umbilical cord. This is the umbilical cord. Okay. And within this umbilical cord, there are there are two umbilical artery. There are two umbilical artery, and these umbilical artery are deoxygenated, carrying deoxygenated blood. Yes, this is artery, but it's carrying deoxygenated blood. Let's imagine this is one umbilical artery, and this is another umbilical artery. Two umbilical artery are there in umbilical cord. What is this? This is the umbilical cord. Okay. So within this umbilical cord, there are two umbilical artery and one umbilical vein and one umbilical vein. Okay. So this is the umbilical vein, but it's not carrying deoxygenated blood, it is carrying oxygenated blood. So one umbilical vein. And now this umbilical vein from the placenta, oxygenated blood from the placenta, oxygenated blood comes through this umbilical vein, and deoxygenated blood from the fetus is drains to the placenta by is drained to the placenta by umbilical artery. Okay. So there are one umbilical vein. This is the umbilical vein, and these two are umbilical artery. Okay. These two are umbilical artery. Anyways, so now what happens now? At this moment, the blood the blood which is coming from the placenta towards the umbilicus is moving is moving towards the liver of the fetus, towards the liver of the fetus, towards the liver of the fetus. Okay. It's moving towards the liver of the fetus. And then and then moving to the liver of the fetus, and then from liver, from liver, it's moving towards the inferior vena cava. From liver, this blood is moving towards the inferior vena cava. Okay, and this is called your ductus, ductus venosus, venosus. This is called your ductus venosus. So, what is the ductus venosus? The blood which is coming from the umbilical vein, from the umbilical vein, the blood is coming from the placenta towards the umbilical vein towards the umbilicus. Then this blood is moving towards the liver, and then from liver to inferior vena cava. And this junction here, from liver to inferior vena cava, at this junction, it is drained by ductus venosus. It is drained by ductus venosus. Okay, so this ductus venosus, this is the nothing but duct at the liver. This is the ductus venosus. Okay, now next next what happens, this blood is actually moving from IVC to right atrium, and then right atrium to right ventricle, and left, I'm not going to discuss much things here, so I'm leaving this here. But the remnant, I'm going to talk about the remnant, first remnant, the ligamentum teres. Which one? What is the ligament of teres? This is the ligament of teres. In later life, when the fetal circulation stops, and later life, after the birth of the child, when the fetal circulation stops, what happens? These things these things the connector between the fetal liver and the umbilical vein, the connector between the fetal liver and umbilical vein, this circuit, this pathway, it is actually converted into ligamentum teres. Okay.
এই লিগামেন্ট অফ টেরিসটাই কি ওই নিচে যেটা লিভারে
Yes,
ছিল?
yes, yes, yes.
ও
Exactly, exactly, exactly. This is the ligament of teres, and this much is converted into this much is converted into ligamentum venosum. This
আচ্ছা।
ductus venosus, in later stage, it is remnant. It is converted into ligamentum venosum. Okay, ligamentum venosum. So that's why I am talking about the fetal circulation here, which is little bit irrelevant. But for your clear concept, what is ligamentum venosum and what is ligamentum teres, you can appreciate this thing now here clearly. So yes, this is the ligamentum venosum, and this is the ligamentum teres. Clear?
টেরিস
Is it
ক্লিয়ার
clear? Which is
ক্লিয়ার
a which plays an important role. Those who are playing an important role in fetal circulations, but in adult circulations they have no role. That's why they are remnant. Okay, remnant structure and appearing like this. Done. Next, the blood supply of liver. So the blood supply of liver is not a little topic, it's not so easy, and it's not a little topic. But for this moment, I'm going to talk this about later in detail. Okay, but for this moment, let's recall this thing. Liver has dual blood supply, so dual blood supply in liver. Okay, one by proper hepatic artery and one by portal vein. Okay, I'm going to draw and explain these things later. But for this moment, just I am emphasizing this thing that the portal vein having major contributions, it has major contributions to the blood supply of liver. The portal vein, it has major contributions to blood supply of liver. So the 70 to 80% blood supply to liver by your portal vein, this point is important. And then proper hepatic artery, but it is 20 to 30%. So important thing is the blood supply of liver by portal vein is much more greater than by hepatic artery. Is it clear? And this is the previous year's question, that's why I am introducing this thing here. Okay, is it clear?
ক্লিয়ার
Okay, next. Yeah, and obviously the venous drainage, that means from liver to drain, someone is draining the blood from liver. Okay, this venous drainage by hepatic vein, and then hepatic vein to inferior vena cava. Okay, hepatic vein to inferior vena cava. I'm going to talk these things later also. Okay, but just this info here. So now, yeah, next one important concept, that is the Calot's triangle. This is very, 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 very important concept, and this Calot's triangle, the concept of Calot's triangle is already updated now. in 41st Grace also, and in Surgery Billion's Lab. These all books are already recently updated the Calotte triangle. So first of all, which one is the old concept of Calotte triangle? Which one is the old concept of Calotte triangle? The old concept is now totally wrong. Okay, this old concept is not considerable. It is totally wrong now. But what is the old concept? The old concept is what? This is the lower border or inferior border of the liver. Okay, this is the inferior border of the liver. And what is this? This is the gallbladder from anterior aspects. From anterior aspects, this is the gallbladder. Okay, and this is the right hepatic duct, and this is the left hepatic duct. Okay, so right hepatic duct, left hepatic duct, gallbladder, and what is this is the common hepatic duct. When right hepatic duct and left hepatic duct are joined with each other, they are forming what? The common hepatic duct. Okay, and the gallbladder, and the duct of the gallbladder is your cystic duct. The duct of the gallbladder is your cystic duct. This is the cystic duct. Now this cystic duct, when it joins with the common hepatic duct, collectively they form common bile duct. Okay, collectively they form common bile duct. So let's start from the beginning. Let's start from the beginning. What? Okay, sorry, just a minute. Let's start from the beginning. Yeah. What? Now let's draw here. So this is the inferior border of the liver. Done. And what is this? This is the gallbladder. Okay, done. So this is the gallbladder. Okay. Now this is the cystic duct. I am writing here CD for cystic duct. And this is the gallbladder. I am writing here GB for gallbladder. And what is this? The anterior aspect of liver. This is the cystic duct. Done. Now, what is this?
Total.
This is the left hepatic duct, and this is the right hepatic duct. Clear? Left and right hepatic duct. And this left and right hepatic duct, these two are joins to form common hepatic duct. Okay, this is the common hepatic duct. Done. Easy. And this is the cystic duct. Now, this cystic duct and common hepatic duct collectively, these two are forming common bile duct. Clear? Clear?
Clear.
Okay. So now, previously, it was considered that this triangle, this triangle, that is, the triangle is forming by the inferior border of the liver, common hepatic duct, and cystic duct. This triangle, are you appreciating this triangle?
Yes.
Yeah. So this triangle, previously it was called that this triangle is the Calotte triangle. Previously, but no. Recently, this is not the Calotte triangle. So this is a wrong diagram. This is the very wrong diagram. Okay. This is a very wrong diagram. Okay. So this is the old concept of Calotte triangle. This is the old concept of Calotte triangle.
Hmm.
This is wrong. Okay. This is wrong. Then what is the actually Calotte triangle? Okay. So the Calotte triangle is actually what? The Calotte triangle, this is the actual diagram of Calotte triangle. Okay. So here you can appreciate this the inferior border of the liver. Yes, you can appreciate this the inferior border of the liver. Yes. Are you appreciating the inferior border of the liver?
Hmm.
Yeah, this is the inferior border of the liver. And this is
Hmm.
the gallbladder. Are you appreciating the gallbladder? And what is this?
Hmm.
This is everything. This is, are you appreciating these things also?
Cystic duct.
The cystic duct, yes, very good. This is the right hepatic duct, this is the left hepatic duct, and this is the common hepatic duct, and you can appreciate this thing, common bile duct. Clear? But now Calotte triangle is something, this one. This is the Calotte triangle. They are forming the Calotte triangle. So the boundary of Calotte triangle is now the boundary of
Cystic duct.
yeah, the cystic duct is
Common
there.
hepatic
Yes,
duct.
common, not common bile duct, common hepatic duct. This is the common
Common
hepatic
hepatic.
duct, and this is the common bile duct. So common hepatic duct, and another boundary of Calotte triangle is what? Another
Instead
bile.
of inferior
Yeah,
level.
another boundary of Calotte triangle is your cystic artery. Cystic artery.
Oh.
This is the another boundary. Okay, and another
Hmm.
boundary is not the inferior border of the liver.
Hmm.
It is the cystic
Cystic artery.
boundary. And previously, when they considered the anatomist, when they considered the Calotte triangle is this much, this is the Calotte triangle. At that time, they also consider that the cystic artery is a content of Calotte triangle. But no, recently in updated module, they are not considering the cystic artery as a content of the Calotte triangle. They're considering the cystic artery. It's nothing but one of the border of Calotte triangle. So this is the recent updated Calotte triangle. It has it is very important. It has very surgical importance. Okay, various surgical importance. It is very important. Okay, during
Clear.
gallbladder surgery, especially.
Mhm.
So recent updated module is telling us that the Calotte triangle is what? Now one border is cystic duct,
Common
another border
hepatic
is
duct,
common hepatic duct,
cystic
and
artery.
yeah, the cystic artery. Okay, so this is the Calotte triangle. This is the Calotte triangle. Okay, so this is
Mhm.
the Calotte triangle. Here we can appreciate this thing. The Calotte triangle, that is also called cystohepatic triangle, is the anatomical space in the abdomen. What is this? You can appreciate this thing here also. This is the Calotte triangle. One of the border of the Calotte triangle is your cystic artery. Okay, I am just
Mhm.
schematically I draw this. One of the border of your Calotte triangle is cystic artery. Another
Mhm.
border is by cystic duct, and
The common hepatic duct.
this is the Calotte triangle. Okay, is it
Mhm.
clear?
Clear.
And previously when the anatomist they considered this is the Calotte triangle, at that moment there are two contents of Calotte triangle. One is your cystic artery, one is when I am talking about the contents, just I am talking about the relevant and important contents. Okay, there are many branches, many etc etc, but all those things are not relevant. Okay, so in the Calotte triangle the content was cystic artery and the lymph node, the lymph node of Lund. Okay, so but now the cystic artery is the border of the Calotte triangle, and only content is the lymph node of Lund. Lund. Okay, this is the important concept. Which the name of the lymph node which is located in the Calotte triangle is lymph node of Lund. Clear?
Mhm.
Is it clear to everyone?
Clear.
Clear? Okay. So here you can also appreciate this that now tell me, now it's a quiz, it's your questions. Now tell me, is it true? These peoples are showing that this is the Calotte triangle. Is it true?
No.
No. So this is a wrong diagram. Okay. This is Calotte triangles. Is it true? No. This is also wrong
No.
diagram. Okay. Done. So now is it clear up to this?
Clear.
Okay. So very good. So this is the falciform ligament. You can appreciate this thing here, the falciform ligament. Yeah, this is the falciform ligament, and this falciform ligament is dividing your liver into anatomical right lobe and anatomical left lobe. Is it clear up to this? Now,
Clear.
which I told previously that this line, which is from IVC to gallbladder fossa or gallbladder, this is the,
Posteriorly.
yeah, posteriorly. This is the IVC. Obviously, you can appreciate these things here also. Look at this.
Mhm.
In anterior aspect,
Mhm.
you can appreciate the impression of IVC also,
Mhm.
which is something hidden behind the liver. Okay,
Mhm.
and now I'm going to join these two lines, this. Okay, now look at this. What is, yeah, this is the IVC. Yeah, something which is located here, and somewhere here is the gallbladder. Okay, which is obviously on the posterior aspects, but some impression, some part of the gallbladder is visible from the anterior anterior aspects also. Okay, so IVC gallbladder.
Mhm.
Now one anatomical line, sorry, one surgical line, which is an imaginary line. It has actually, in reality, there is no existence of this line, but in reality, the falciform ligament is exist. But it is the imaginary line, and this imaginary line, it is dividing your liver into two segment. This is the surgical left lobe. This much portion. This is totally the surgical left lobe. This totally, it is totally surgical left lobe. This much totally, and this is
Mhm.
totally the surgical right lobe. Clear? But once again,
Clear.
this much is anatomical. This much is anatomical right lobe, and this much is anatomical left lobe. Done? Is it clear? Clear
Mhm.
up this? Okay. So this is called your Candelis line. which I already told. Now, important thing is Coinard classifications. Okay, this classification is actually the clinical classification. It has a very it is very important in surgery. So, what is the Coinard classifications? And this classification is based on what? This Coinard classifications. Look at this. This Coinard classifications of liver. Coinards actually classified the liver into various lobes, and this classification is based on the portal veins and hepatic vein. But the question in 2019 AIMS it was that which one is most important? Is it the portal vein or hepatic vein? Yeah, the Coinard classifications of liver, the lobes of liver, obviously it includes your portal vein as well as hepatic vein. Both are included. But tell me which one is more important? Then answer is your portal vein. So this is your most important. Is it clear?
Hmm.
Is it clear? So portal vein is most
Hmm.
important. Now look at, let's imagine, let's imagine this is the liver, okay, and look at this. There are some hepatic veins. Yeah, there are some hepatic veins. This is the left hepatic veins. Okay, this is the left hepatic veins. This is the mid hepatic veins, and this is the right hepatic veins. Clear? There are major three hepatic
Hmm.
veins. Okay, and you can appreciate this thing here that somewhere the right portal veins is moving towards this. This is the portal veins. Right portal veins. Sorry, left portal veins. This is the left, and this is the light right. Done. Easy. Clear?
Hmm.
That is clear. So this is the right and this is the left. And now you can appreciate all the segments of liver. And this is nothing but the Coinard classification. This Coinard classification is totally based on the hepatic vein. These three are hepatic veins, and this one is your portal veins, and this one is your portal veins, right and left branch of portal veins. So now the segments are named anti-clockwise. Okay, there are many various numbers. There are various numbers, and the numbers started from. Let's. I'm going to draw this here. Four. Okay, four. Okay, let's start from here. Two, three, four, five, six, seven, eight, and nine. No, there is no nine. There is no nine. Actually, this whole things is four. This whole thing is four. So start from two. Start from the two. Okay. Start from the two, and go anti-clockwise and go anti-clockwise or counterclockwise or anti-clockwise with this number 2, 3, 4, 5, 6, 7, 8. Now this is 4a and this is 4b. This is a single lobe, 4a and 4b. Clear? Coined,
Clear.
coined, coined numbering clear.
Hmm.
Okay, then where is the lobe one? Where is the lobe one? The lobe
Hmm.
one, sorry, actually, one little mistake is there. This is A and this is B. Sorry, extremely sorry. So, the lobe one, I already told previously, is not visible anteriorly. The lobe one is visible posteriorly. This is the caudate lobe, and this is independent lobe of liver, and which is visible posteriorly. Is it clear?
Hmm.
And a part of lobe 4b, a part of lobe 4b also visible posteriorly. This is a part of 4b which is visible posteriorly. Okay, this is a part of 4b. Actually, this lobe 4b is something like what? This is something like this 4b is also.
ওয়ানটা কখন ভিজিবল হবে বলে?
Just a minute, just a minute, just a minute, just a minute. Yeah, the 4b, it is something. It is something what the 4b is something also extended into backwards. Little bit, it's also extended into backwards. Okay, so this is the 4b which is appreciated from posteriorly, and 1a is actually behind this. Posteriorly, you can appreciate 1A here. Posteriorly, you can appreciate 1A here. 1A appreciated here, but not anteriorly. Posteriorly, this is the 1A. Posteriorly, but anteriorly, this 1A is covered by 4A. Is it clear?
Clear.
100% clear?
Hmm.
Okay, so this is the coordinate classification system. So now this coordinate classification system is nothing but the segments of liver. You can appreciate these things. This coordinate classification system is totally based on the hepatic vein and the portal vein.
Portal vein.
But most
Hmm.
importantly, if you
Portal
have to
vein.
select one, then portal vein is the right choice, and it was the question of 2019 EMS. Okay, now
Hmm.
this is the middle hepatic artery. This is the hepatic artery, and this is the right hepatic artery. Are you appreciating these things? Are
Hmm.
you appreciating these things? And what is this? This is the left branch of portal
Right.
vein, and this is the
Hmm.
right branch of portal vein, which is the most important tools for this classification of coordinate classifications. Okay, and you
Hmm.
can appreciate this. Start from the two, start the numbering from two, and move
Hmm.
anti-clockwise. And move anti-clockwise. You can appreciate everything here. Two, then three, then four, two, three, four. This whole segment is four. Okay. Next five, six, seven, eight, and further 4A and 4B. This 4 is divided into 4A and 4B. There are total 8 segments. There are total 8 segments. Okay. And the segment one, which is also called the caudate lobe, this is not appreciated anteriorly, but this caudate lobe is appreciated posteriorly. Am I clear?
Hmm.
Am I clear?
Clear.
Okay. So this is the coordinate classifications, coordinate systems, and this coordinate system, it's it's very important in surgery. Now, this is about the segment of liver, lobes of liver. It's a right and left surgical lobe, and then the segments. This is the segments. This is the segments. This is the first segment, second segment, etc. etc. This is the segments. Now, if they are talking about sectors, if they are talking about sectors, they are talking about sectors. So how many segments are there? 8 segments. Okay. So if they are talking about sectors, so now the sectors, these two, that is, you can appreciate these things here also. You can appreciate this thing here also. These two are under right lateral sectors. Okay. First of all, this is the midline. This is the midline. Okay. Sectors presents at these positions are right sectors. Sectors presents at this domain are left sectors. Okay. Now, if they are located towards midline, then they are medial. If they are located away from the midline, then they are lateral. So these are the right sectors, and this is what, this is towards the midline, so this is right medial sectors. This is away from the midline, right lateral sectors. This is left sectors, and this is left lateral because this is away from the midline, and this is towards the midline, that's why this is medial sectors. Okay, is it clear?
Hmm.
First of all, the
Clear.
concept of sectors, is it clear? Right sectors, right lateral, right medial, left lateral. Sectors concept clear.
Hmm.
Now, which
Hmm.
segments are in which sectors? Which segments are in which sectors? This is very simple. It is already appreciated in this diagram that these two, these two are in sector right lateral. These two are in right lateral sectors. Clear? So that is your 6 and 7. 6 and 7 in your right lateral sectors. Clear? This much. This much portion. Am I clear? Am I
Hmm.
clear or not?
Hmm. Clear.
Okay. So next, segment 5 and segment 8. These two are in right medial sector. Segment 5 and segment 8 are, these two are in right medial sector. Am I clear?
Clear.
Okay. And next is what? The left medial sector. The left medial sector, you can appreciate the whole four. The whole four. This is the whole four. And four is also divided into 4A and 4B. Ah,
Hmm.
so this whole four is under left medial sector. Are you appreciating this?
Hmm.
Okay. And the left lateral sectors,
2 and
there
3.
must be two and three, but no, this three is not in the, no, this three is not actually liver is a three-dimensional structures. Okay, and we are representing this three-dimensional structures in two-dimensional. Okay, so this is a little bit difficult to draw everything properly or everything perfectly. Okay, but actually this segment is under this. This is a little catch. This little catch is here that the segment 3 is not in the left lateral sector. The left lateral sector is only found by segment 2, but segment 3 is under the left medial sector. This is only the catch. Okay, clear? This is the only catch. Am I clear?
clear.
So this is the coordinate classifications. So you can recall these coordinate classifications on the basis of your fist. Okay, on the basis of your fist. So this is the fist, and what is this? This is the IVC, that is inferior vena cava, and this is the middle hepatic vein. This is the right hepatic vein, and this is the left hepatic vein. Is it clear, beta?
Hmm.
And these knuckles, and the knuckles are your the portal vein. This is the right portal branch, and this is the left portal branch. Clear? And all the structures you can appreciate here, the segments, anti-clockwise the segments, and you can appreciate the thumb. You can appreciate the thumb. Here is the thumb,
Hmm.
which is hidden behind the index finger and middle finger. Are you appreciating?
Hmm.
Are you appreciating this thumb is hidden behind? And this
Hmm.
is actually the caudate lobe of the liver and segment one,
Hmm.
which is not appreciated frontally, which is not appreciated frontally. Clear or anteriorly? Is it clear, beta?
Clear.
Okay, is it clear? Clear. So here you can appreciate the all segments also in various aspects. This is the posterior aspects, anterior aspects. This is the posterior aspects. This is the anterior aspects. You can appreciate this. Oh, okay, and everything. This is the posterior aspects. You can appreciate various points, segments. Okay.
Hmm.
So yeah, this is the sectors. This is the classification of sectors. This is the you can appreciate these things also here. This is the lobe 2, this is the lobe 3, this is the lobe 4, this is the lobe 5, 6, 7, and 8. Okay. Actually, you can appreciate this thing. The lobe 4, it is a large, single large lobe. You can appreciate it. Single large
Hmm.
lobe.
Hmm.
Okay. And you can appreciate
Able.
also the sector, the left lateral sector. Are you appreciating the left? This is the actual left lateral sector. The
Hmm.
uh, it
Quad.
is it is a little bit hazy, but I'm telling you that this is actually the diagram which is taken from Gray's Anatomy. Okay.
Hmm.
And this is your left lateral sector. Clear, beta? This is a left lateral.
Hmm.
Yeah, this is the left lateral sectors, and this is your left medial sectors towards midline.
Hmm.
And you can
Hmm.
appreciate these things in left medial sectors. They are in fourth segment and third segment. Clear? And now we can appreciate this is the right medial sectors, and right medial sectors there is segment 8 and segment 5. Are you appreciating?
Hmm.
And this is the right lateral sectors. So this is the sectorial classifications. Okay, so segment sectors, everything is there. I already told these things. Told also told these things here. Okay, so but recently these all studies are old concept, but very recent update is telling something that the classification of segments, liver segment classifications, it is not only portal vein or hepatic vein, it is also on the basis of hepatic artery and bile ducts. Okay, so there are four tools. There are four classification tools, that is portal vein, hepatic artery, and bile ducts. Clear?
Yep.
But which one is less important among those four? Which one is less important? This is your hepatic artery. So this is the least important. Okay. So recently the liver segments are classified on the basis of these four tools. But which one, if anyone is least important or less important? Yes, which one is that? This is the hepatic artery. Okay, is it clear?
Hmm.
Now, segment four is extended posteriorly. I already told this statement also previously. And segment one is also called caudate lobes, having bilateral supply of both right and left artery and vein and duct supply. I'll talk these things later also. Actually, segment one or caudate lobe, sometimes this is also called the third lobe of the liver. Okay, first right lobe, left lobe, and third lobe, because it has totally different supply. I'll talk this all things in later. Okay, in later class. Okay, is it all clear to you? Okay, you can appreciate
Good.
also this diagram is coinate segments. This is the falciform ligaments, which is anatomical ligament, anatomical, and you can appreciate two, three, four, and five, six, seven, eight, and also one, which is little bit posterior.
Hidden.
Okay, which is little bit posterior.
Hmm.
Very good. So this is the basic introduction on liver, and I think that's all for today. Okay,
Hmm. They created to these, okay? What's up?
okay, sure, sure, sure.
Hmm. Is it